But it was at about this time I remember first meeting you. I had just published my books on the discovery of insulin and banting, and you gave me the impression that you thought that this was the banting achievement round 2.
Well, it really did look like, because those were in early days, that it would be a matter of refining how early you started. Because patients who were treated after 6 weeks, there was only 15 or 20% of them became insulin independent. Whereas if you treated within 6 weeks, the sooner you treated after the diagnosis, the higher the incidence of a return to near normal glycemic control. So it looked like a matter of refining the diagnosis and time to treatment. It turned out that, in fact, cyclosporin was too toxic. We found out that the levels you had to have out after 1 and 2 years were so high that you began to get permanent damage to the kidneys. And so we had to stop it. This, however, was after we had done a randomized controlled double-blind study internationally involving Europe and the US and Canada. It was an extraordinary study published in Science. And although it didn't turn out to be the definitive treatment, it did turn out to be the definitive demonstration that type 1 diabetes was an autoimmune disorder that could be managed, controlled, reversed by immunosuppressive therapy if caught early enough. And so subsequent to that has been the search for an agent that is not toxic, or a way in which you can reestablish tolerance.